Welcome back, nurses. This tells me one thing: you are very much interested in passing your exam on your first attempt. Now, on NCLEX, you'll see a lot of SATA questions that actually confuses students and also make them worried. But what's the right approach? How do we approach these questions and not lose the marks on exam? That's exactly what I'm going to teach you in the next few minutes. You see, in my courses, I teach you how to stop guessing and how to treat every answer choice as a single true or false statement. I see a lot of my students initially lose their marks just because they're falling for the traps in the exam. And the common one, they're second guessing their instincts. But today, we change that. Let's break down a few questions for you on the screen right now. So the first question is, a nurse is monitoring a client receiving a transfusion of packed RBCs. Which clinical manifestations would support a suspicion of transfusion-associated circulatory overload, which is TACO? It's a SATA question. You have few options. Option number 1, bilateral crackles at the lung bases. 2, jugular vein distension. 3, acute severe hypertension. 4, rapid spike in systolic blood pressure. And 5, production of pink frothy sputum. Look at the screen with me. The question is asking for manifestations of TACO. Remember what I teach my student, TACO is a volume problem, a mechanical backup of fluid because the blood ran too fast. So let's analyze each option. So option number 1 is bilateral crackles. So if you see the screen, it's actually a true statement because now fluids is backing up in the lung and we are going to select it. We have option number 2, the jugular vein distension. That's exactly what's going to happen with the fluid overload. So the fluid backs up into the neck of the patient. So yes, we're going to select that. Option number 3, we have acute severe hypertension. Now this is a trap, the NCLEX trap, you can say. This is where the students are going to lose their marks. Now, what happens in TACO? It's causing a fluid overload, which actually increases the pressure, but that increasing pressure is contradictory with hypertension. So you're not going to see hypertension. Hypertension happens when patients are going in shock, not in TACO, because TACO we have an overload. Now, so leave this option alone. We don't have to pick this one. Let's see the option number 4, the rapid spike in systolic blood pressure. That's exactly true. There's nothing wrong. There is excess fluid, which is equals to hypertension. So I'm going to select that. Let's see option number 5, the pink frothy sputum. That's also true. Now that's the classic sign of severe pulmonary edema. So we cannot ignore that. We have an overload in the patient system. So the symptoms have to be, aligning with the fluid overload that's coming from the heart. So I am okay to pick all these options. So as for me, the correct answers are 1, 2, 4, and 5. So I'm going to leave option number 3 alone because that's a trap. Let's do question number 2. A nurse is preparing an educational session on infection control for an active shingles outbreak. Which statement should the nurse include? It's a SATA question. Your option number 1, localized shingles require standard contact precautions if the lesions are covered. 2, disseminated shingles require airborne and contact precautions. 3, non-immune individuals exposed to fluid will develop localized shingles. Number 4, pregnant healthcare staff should not be assigned to client with disseminated shingles. Number 5, shingles lesions should be left completely open to room air to promote drying. Now, these are your 5 options. So let's discuss them. Now, if you see the question pattern, we are talking about shingles transmission. Now, this is the ultimate NCLEX mind game. It's causing a lot of students to second guess and it's also panicking them. Infection control is always heavily tested on NCLEX. So we want to pay attention to each word, how it's used in the answer statements. So option number 1 is localized and covered needs contact precautions. This seems a true statement. If it's covered, the virus cannot come out to the environment. Remember, the shingles virus, the herpes zoster, is a very lightweight virus. It has tendency to stay in the air because it does not settle down on the floor. So that's going to be true. Option number 2, disseminated needs airborne and contact. Yes, of course. Disseminated means it's widespread and it can also aerosol into the air. So we have to put the airborne and the contact precautions. Your option number three, non-immune exposure causes shingles. No, we do not like this one. This is exactly the trap the students will fall for. So if you do not have immunity and if you touch the fluid, the students and the patients can get chickenpox. Now, it's the chickenpox that is getting transferred, not the shingles. So you cannot catch shingles from someone else. It's an inside job, it's the nerve problem. So you leave that alone. Your option number four, restrict pregnant staff. Yes, this is a very good statement. I like that. I don't want to expose pregnant women to such conditions. So that's going to be a true statement. Let's see the last option, option number five, leave open to air. False, we always keep them covered because we do not want the fluid spreading up in the air. So we want to cover them. We are never leaving them open to dry. Nurses, look what we have accomplished in the last few minutes. SATA questions are not your enemies. Nurses, these are just few examples of SATA questions, but there are actually more. Click the link below to get the free assessment quiz to check your knowledge, and you get to book one-on-one free call with me.